I'm really passionate about dry eyes. I think it affects so many people out there, and there's always new things on the market that are coming out to help treat dry eyes. And so that is one thing that I'm constantly doing research on to find the next best available treatment or how I can better manage the dry eyes in my patients. Not that dry eye is complicated, but there are different aspects to why someone might have dry eye. There's a lot of different factors that go into it, age being one, screen time, being a female in general, not producing enough tears, autoimmune diseases. So there's a lot of different things that could contribute to dry eyes. And so that's why the same approach may not work for every single patient. When a patient comes into the clinic and we either see dry eye on their exam or they complain about symptoms that might be related to dry eye, the first thing that I do is always try to find the root cause of what may be causing their dry eye. Is it that their Meibomian glands are clogged? Is it that they're not producing enough tears? And so once we find out the root cause, then we can individualize and tailor their specific treatment plan in terms of fixing their dry eye. Dry eye can definitely be treatable. However, it is a chronic condition, meaning that there are definitely times where it can flare up and there are times where your eyes can feel better and then worse again. And so there are things that you sometimes have to incorporate into your routine, your daily routine, to make sure that the dry eyes are being treated and that they don't continue to flare up. The symptoms of dry eyes can be frequent tearing, feeling like there's sand or a gritty sensation in the eye. Sometimes you can get very sharp stabbing pain in the eye as well, foreign body sensation. The eye can be red or irritated as well when you have dry eyes. There are various treatments for dry eyes. Home treatments can include doing warm compresses, either with masks that have cooling beads that you can just pop in the microwave, or taking some rice and putting it in a sock and popping it in the microwave. And then other things include making sure that you're cleaning your eyelids and your eyelashes. So having good lid hygiene can also be very important for dry eyes. There are over-the-counter options as well called artificial tears that can help moisturize the surface of your eyes. And then we do have prescription drops for dry eyes as well. We can also do in-office procedures. So kids can definitely get dry eye, especially if they spend a lot of time on screens, iPads, video games. It really reduces their blink rate, and so that can definitely contribute to worsening dry eyes. Prescription medicines that they may be on, such as retinol or Accutane, can also contribute to dry eyes as well. So it's very important to give a full history when you come into your eye doctor in terms of medications and screen time use. Blepharitis is when you get scruff material that sits on your eyelids and eyelashes. Sometimes this can be caused by a mite called Demodex, and it can proliferate, especially at nighttime. It can come out and create these molecules on your eyelashes that can contribute to crusting in the morning, eyelid irritation, redness. Those are all kind of symptoms of blepharitis. Hormonal changes, medications, pregnancy, stress, lack of sleep, those are all different conditions that can also affect dry eyes as well. Certain autoimmune conditions such as thyroid issues, Sjogren's syndrome, rheumatoid arthritis can all affect the eyes and also contribute to dryness. In Sjogren's syndrome and thyroid disease specifically, you don't produce enough tears, and so that can contribute to dryness just because your body isn't producing enough tears to help keep your eye moisturized and lubricated. Makeup tips for someone who suffers from dry eyes. My number one tip is always to make sure you're really cleaning off your makeup at the end of the day. I usually like to use micellar water or a good eyelid eye makeup cleansing routine. Clinique is a brand that is very safe for the eyes. But anything that really makes sure that you're getting your makeup off before the end of the day and not sleeping in your makeup is really key. Also try to avoid any waterproof mascara. It's really hard to get that off, and sometimes even though you think you may be getting all of it off, there may be clumps that are still sitting on your eyelids and eyelashes that can further contribute to the dryness.